Hello, thank you so much for being here as we continue our football series with Banner Sports Medicine. This is our second segment in the series, and today we're going to be touching on the mental health of student athletes. This is a really important topic, and we're joined by Dr. Steve Erikson, who is the Chief of Primary Care Sports Medicine for Banner. Thank you so much for taking the time to chat with us.
Thanks. This is a really important topic that's getting a lot of attention in the press.
Yeah, so let's get right into it. What would you recommend to students who are athletes and they're maybe getting over a loss, or they're preparing for the season, or they're preparing for a really high pressure game?
So I think in general, student athletes in general need to adapt a new mindset. And there's been a lot of attention at the NCAA level, at professional sports level, to really normalize this as part of healthcare, because it really is just part of healthcare. We all have symptoms of emotional stress, that there's nothing wrong with you if you have anxiety or depression, and that's okay, and it's not okay to not get care for that. So all athletes should have some attention to their mental health. And there's lots of mental health checklists and things that you can do towards that. We partner with sports psychologists to normalize that right within the performance enhancement part of our center and in our clinic as sports psychologist, to talk to them about the performance enhancement part of sports psychology. Because if you want to get to if you want to play in the pros, that's an important part of it. Because there's a lot of people that have just as much talent as you do, but it may be what you're taking care of your mental health and your anxiety and how you look at that part of your health that might be the difference between you making it to the next level or not. So sleep is important. Identifying ways to manage your stress when you're stressful, visualization exercises, meditation. I tell my athletes, it's not just for Buddhist monks anymore, it's for everybody. It's on your phone. You can download a free app and you can meditate and it will focus you. So there's lots of things that you can do to take your mental health into your own hands to help with a problem or to prevent a problem.
And sometimes if you're not taking care of what's happening up here in your head, you could start to notice some physical manifestations of that anxiety or that distress or even depression, right? What are some of those signs and symptoms?
Absolutely. It could be physical manifestation, or it can be manifestations in another way. The physical manifestations are insomnia, difficulty getting to sleep, difficulty waking up in the middle of the night and can't get back to sleep, low fatigue, just more emotional, palpitations. One of the things that a lot of athletes don't catch is that what's going on the court may have every bit to do with the anxiety, depression, emotional stress that they're having. And their performance, they want to compartmentalize it, but their performance may not improve. Quarterback may, usually throws 60% completions and is throwing 30% completions, and he wonders why. Well, it's because he's not sleeping well at night, and he's really anxious when he goes out there, and maybe he's anxious because he's afraid of getting sacked because he's had a couple of really bad sacks. And until you deal with those emotions and fear, then you may not get out of that slump.
What would you say to parents? What should we be looking out for in our children if we think that, maybe something changed and it could indicate a mental health issue? What should we know?
Well, first you got to know your child. First, you need to go back to the days of, in our house, sitting down to the table to have meals and everybody putting their phone away and actually having conversations and being abreast of what's going on in people's lives. Because if you know what's going on in your children's lives, then if something is amiss, then you may have that signal. But looking like they're really tired, feeling like they're really tired, complaining that they're not sleeping well at night, poor performance in school, poor performance on or off the court or field, substance abuse, changing friend groups with people that might not be the best friend group for your kid. There's lots of signals that are various intensities, whether they're important or not important, or various levels of importance. But all those things are signals that you should know. But first, know your kid and know when something's not right.
Yeah, that connection is where it all starts.
Absolutely.
Thank you so much for all that great information. We really appreciate you.
My pleasure.
And thank you for watching. We'll see you again soon as our series continues.